I'll be talking about a machine learning approach to optimize the accuracy of serial troponin measurements. Coronary artery disease leading to type 1 myocardial infarction, which is defined as having a ruptured plaque leading to cell death, is an acute life or death situation requiring rapid assessment and triage. Troponin assays are commonly used in the assessment of suspected MI, and as high sensitivity troponin assays are becoming more abundantly available, more people will have positive troponin values. The problem is that elevated troponins do not necessarily correlate with myocardial injury stemming from clinically significant coronary artery disease, requiring urgent catheterization. In particular, patients with lower GFRs may have artificially higher troponin levels that do not necessarily correlate with clinically significant coronary artery disease, but are particularly vulnerable group to coronary artery disease. What to do next? So chest pain protocols, serial troponin measurements, such as delta change in troponin at varying intervals, have been used to try and better optimize troponin readings. However, these methods often lack the ability to incorporate the plethora of variables that result in clinically significant coronary artery disease. Nonlinear analytic methods, such as machine learning algorithms, are often better suited to identify patterns in larger multivariable data sets when compared to standard statistical approaches such as linear and logistic regression models. Previous ML algorithms, such as the MI3, demonstrated good prediction of type 1 MI. However, none have explicitly incorporated GFR. Therefore, we expect that ML would help better predict clinically significant coronary artery disease in patients with serial troponin measurements. We retrospectively trained and tested XGBoost ML algorithm, which is a type of gradient decision tree machine learning algorithm on 631 patients from several Wayne State University emergency department sites who had contemporary troponin measurements and GFR measurements regardless of their EKG changes. Compared with logistic regression analysis to clinically significant coronary artery disease. And so clinically significant coronary artery disease was defined as having over 70% stenosis via coronary angiography or needing CABG or PCI. Stratified GFR was defined as high if it was over 60, moderate if it was 60 to 30, and low if it's less than 30. Over 50 patient variables were assessed in this. Here we see the patient demographic data. You can see between the two cohorts that in the no clinically significant coronary disease and the clinically significant coronary disease, most of the demographics are all the same, including percentage of chronic kidney disease and also estimated glomerular filtration rate and creatinine. So for the results of our study, 166 patients had clinically significant coronary artery disease. Average time difference between first and second troponin measurements was 8 to 14 hours. Our machine provided an area under the curve of 0.67 versus 0.65, which is standard statistical approaches using multivariable logistic regression. So this is the slide that shows the important features of our machine in making a prediction for clinically significant coronary artery disease. The number one variable would be ST elevation on the EKG. Number two would be troponin 1 and 2 difference, so the delta change in troponin. Number three would be hyperlipidemia, and number four would be the time difference between the first and second troponin levels. So in conclusion, our machine learning algorithm automatically identified pertinent variables to improve AUC, albeit it was a modest improvement due to contemporary assay usage. However, if we used higher sensitive assays, we would expect a much greater performance of our machine. Also, machine learning algorithms are known to perform better when tested on outside data sets compared to SSAs, which is a unique advantage of MLs over SSAs. We are currently training our machine learning algorithm with high sensitivity troponin assay data to improve the prediction accuracy of our algorithm.